Why, hello once again. This is my third video now on painkiller ingredients, I guess you can call it. Hopefully you checked out my one on acetaminophen and my second one on ibuprofen. So now we are looking at Naproxen. I actually never heard of Naproxen before. No one ever really says that because it seems like it always goes by its brand name of Aleve. So never heard of Naproxen until I started doing all this research. But let's just learn about this a little bit. I mean, it's good to know about Aleve. I've heard of Aleve, and I don't know the difference between Aleve, Tylenol, Advil, yada, yada, yada. So let's get into it. What is Naproxen? Naproxen is an NSAID, okay? It's just like ibuprofen is. It works by reducing the hormones that cause inflammation and pain in the body. Naproxen is used to treat pain or inflammation caused by conditions such as arthritis, ankylosing, I don't know what that is, I'm not going to try to say it, tendinitis, bursitis, gout, or menstrual cramps. It can also be used to treat acute pain caused by other conditions not listed in the medication guide. So this almost sounds like it's more for like joints based on tendinitis, gout, arthritis. The delayed release or extended release tablets are slower acting forms of naproxen that are used only for treating chronic conditions such as arthritis or that one. These forms will not work fast enough to treat acute pain. Yeah, so that's like for, just like Aleve says, all day long, all day strong. Now I get it, because it's slow release. So when you have arthritis, it goes all day. So then let's say your hands can function well enough for you throughout the day. Warnings. You should not use naproxen if you have a history of allergic reaction to aspirin or other NSAIDs. Naproxen can increase your risk of fatal heart attack or stroke, especially if you use it long-term or take high doses, or if you have heart disease. Even people without heart disease or risk factors could have a stroke or heart attack while taking this medicine. Huh. That's weird, because isn't Aleve the one that they... What's the one that they always said was... No, Bayer. What's the Bayer one? I don't know, I'm trying to think of the one that they say is good if you're having a heart attack. To pack down a couple of those and it's supposed to help you right away. Anyhow, do not use this medicine just before or after heart bypass surgery. Get emergency medical help if you have swelling of the face or throat, chest pain, weakness, shortness of breath, slurred speech, or problems with vision or balance. Stop taking naproxen and notify your physician if you notice stomach pain, tiredness or weakness, yellow skin or eyes, nausea, vomiting, bloody or black, and sticky bowel movements, skin rash, unexplained weight loss or weight gain, or swelling of the hands and feet. Naproxen may also cause stomach or intestinal bleeding, which can be fatal. These conditions can occur without warning while you're using this medicine, especially in older adults. Before taking the medicine, you should know that naproxen may also cause stomach or intestinal bleeding, which can be fatal. These conditions can occur without warning while we just read that. You should not use naproxen if you are allergic to it, or if you have ever had an asthma attack or severe allergic reaction after taking aspirin or another NSAID. Ask a doctor before giving naproxen to a child younger than 12 years old. Ask a doctor or pharmacist if it is safe for you to use this medicine if you have heart disease, high blood pressure, high cholesterol, diabetes, or if you smoke. If you have a history of heart attack, stroke, or blood clot. If you have a history of stomach ulcers or bleeding. If you have asthma, if you have liver or kidney disease, if you have fluid retention issues, or if you take aspirin to prevent heart attack or stroke. If you are pregnant, you should not take naproxen unless your doctor tells you to. Taking an NSAID during the last 20 weeks of pregnancy can cause serious heart or kidney problems in the unborn baby and possible complications with your pregnancy. It may not be safe to breastfeed while using naproxen. Ask your doctor about any risk. Naproxen is not approved for use by anyone younger than 2 years old. Do not give this medicine to a child without medical advice. How should you take naproxen? Well, you should take it exactly as directed on the label, or as it is prescribed by your doctor. Do not take this medicine in larger amounts or for longer than recommended. Use the lowest dose that is effective in treating your condition, much like ibuprofen, because, well, they're both NSAIDs. Shake the oral suspension liquid well just before you measure a dose. Measure liquid medicine with the dosing syringe provided, or with a special dose measuring spoon or medicine cup. If you do not have a dose measuring device, ask your pharmacist for one. If you change brands, strengths, or forms of this medicine, your dosage needs may change. Ask your pharmacist if you have any questions about the kind of naproxen you are using. If a child is using this medicine, tell your doctor if the child has any changes in weight. Doses are based on weight in children, and any changes may affect your child's dose. If you use this medicine long term, you may need frequent medical tests. This medicine can cause unusual results with certain medical tests. Tell any doctor who treats you that you are using naproxen. You should also store this at room temperature away from moisture, heat, and light. Keep the bottle tightly closed when not in use. What happens if I miss a dose? The same as others. It doesn't really matter too much. What happens if you overdose? Call the poison line. What should you avoid? You should avoid drinking alcohol as it increases your risk of stomach bleeding. You should also avoid taking aspirin unless your doctor tells you to. Also, ask your doctor before taking any other medication for pain, arthritis, fever, or swelling. Many medicines available over the counter contain aspirin, salicylates, or other medicines similar to naproxen, such as ibuprofen or ketoprofen. Taking certain products together can cause you to get too much of this type of medication. Ask your doctor before using an antacid, and use only the type your doctor recommends. Some antacids can make it harder for your body to absorb naproxen. Naproxen side effects. Get emergency medical help if you have signs of an allergic reaction to naproxen, which would include wheezing or trouble breathing, hives, swelling of your face, lips, tongue, and or throat. Get emergency medical help if you have signs of a heart attack or stroke. These include chest pain spreading to your jaw or shoulder, sudden numbness or weakness on one side of the body, slurred speech, or feeling short of breath. Stop using naproxen and call your doctor at once if you have shortness of breath, even with mild exertion, swelling or rapid weight gain, the first sign of any skin rash, no matter how mild, signs of stomach bleeding, bloody or tarry stools, coughing up blood or vomit that looks like coffee grounds, liver problems, which would include nausea, upper stomach pain, itching, tired feeling, flu-like symptoms, loss of appetite, dark urine, clay-colored stools, or jaundice. If you have kidney problems, which would be little to no urinating, painful or difficult urination, swelling in your feet or ankles, or feeling tired or short of breath. If you are having anemia, which is low red blood cells, which would be pale skin, feeling lightheaded or short of breath, have a rapid heart rate or trouble concentrating, or a severe skin reaction, which could include fever, sore throat, swelling in your face or tongue, burning in your eyes, skin pain followed by a red or purple skin rash that spreads, especially in the face or upper body, and causes blistering and or peeling. Common naproxen side effects may include indigestion, heartburn, stomach pain, nausea, headache, dizziness, drowsiness, bruising, itching, rash, swelling, or a ringing in your ears. What other drugs will affect naproxen? Well, you should ask your doctor before using naproxen if you take an antidepressant, such as citalopram or these other ones, Prozac, Zoloft, etc. Taking any of these medicines with an NSAID may cause you to bruise or bleed easily. Ask a doctor or pharmacist if it is safe for you to use this medicine if you are also using any of the following drugs. As you can see, the list is right here. Slow the video down and look through it. And that's all. So I guess so far what I'm gathering is the difference between basically Tylenol, acetaminophen, ibuprofen, and this one. What was this one called again? Naproxen, is that they seem to be gradually stronger as you go up. And naproxen, I think what I'm gathering is naproxen is the strongest, but it comes in like a slow release, so it has the potential to last all day. Where the other ones are kind of like, they blast out in you and then they last for, X amount of time. where this one could last potentially all day. So anyhow, that's all we got for this one. And until next time, I hope you already know, I said see ya.